Most people who have a stroke never saw it coming. Not the day before, not the week before. But the signs were there, sometimes for months. Hidden inside moments they dismissed as tiredness, age, stress. Things that seemed so small, they never mentioned them to a doctor. What I'm going to share with you today isn't a scare tactic. It's what I've spent over 2 decades learning from patients who said, afterward, "I wish I'd known." My name is Dr. Elena Vasquez. I'm a vascular neurologist, which means I specialize specifically in strokes, how they happen, how they start, and far too often, how they could have been stopped. I've been practicing for 23 years, the last 14 of which have been at a stroke center where we see patients in every stage. Some who came in time, and some who didn't. The reason I started making these videos is because of a man named Gerald. He was 61 years old, a retired high school football coach. Strong build, sharp mind, big laugh. His wife brought him in 3 days after he'd fallen in the kitchen. She'd assumed he tripped. He assumed the same. By the time we got to him, the window for treatment had closed. And the thing that stays with me, still after all these years, is what he said from his hospital bed. He said, "I felt off for weeks. I just thought I was getting old." That sentence is why I'm here. Because off has a name. And the name is not getting old. Sign 1. The balance that slips without warning. Most people assume that losing your balance means falling down, a dramatic stumble, something obvious. But the first sign almost never looks like that. It looks like this. You reach for something on a shelf and you catch yourself on the counter. You stand up from a chair and take one sideways step before steadying. You're walking down a hallway you've walked 1,000 times, and for half a second, the wall looks closer than it should. It's over in an instant. You write it off. And then it happens again. What's actually happening inside the body when this occurs is something most people never get explained to them clearly. The cerebellum, the part of your brain that coordinates balance, relies on a constant, uninterrupted flow of blood to do its job. Think of it like an orchestra conductor. When the blood flow is steady, every musician plays on time. But when the blood supply stutters, even for a fraction of a second, the timing goes wrong. One section comes in late, and you feel it as an unexpected lurch, a sideways drift, a moment where your body moves in a direction you didn't tell it to go. I always explain it to patients this way. Imagine driving a car, and for just 1 second the steering responds a half beat too late. You correct. You keep going. But something felt wrong, and you know it. According to data published in the journal Stroke, sudden unexplained balance disturbance is one of the most underreported pre-stroke symptoms. Not because patients don't experience it, but because it passes so quickly, they assume it was nothing. It's most noticeable in the morning. That's important to understand. The first 10 minutes after you get out of bed, when your blood pressure is adjusting and your circulation is reestablishing itself, that is when the cracks in the system show. If you've been catching yourself more in the morning than any other time of day, that pattern matters. Pay attention to when it happens. Not just that it happens. When. One practical thing you can do starting today. Stand with both feet together, close your eyes, and try to hold still for 30 seconds. If you sway significantly or have to reach for support, mention that to your doctor. Don't file it under "just getting older." File it under "I need to bring this up." Sign 2. The headache that lives behind one eye. Everyone gets headaches. That's exactly the problem. The headache I'm describing here doesn't feel like the ones most people are used to. It's not the tension band across the forehead after a long day on a screen. It's not the throbbing of a migraine that you recognize and have medication for. This one lives behind a single eye, or just above one temple. It's a dull, persistent pressure, sometimes a mild throb, that comes and goes over days or weeks. It's not dramatic enough to make you lie down. It's just there, like a radio playing in another room that you can't quite tune out. What's happening is this. The blood vessels supplying the front of the brain, particularly the middle cerebral artery and its branches, can experience episodes of increased pressure or partial blockage that don't cause a full stroke, but announce that something is destabilizing. The pain is the body's imprecise signal that the circulatory environment around the brain is under stress. Think of it like a pipe under your kitchen sink that's starting to build pressure. The faucet still works. Nothing has burst yet, but there's a hiss you're not supposed to be hearing. The NIH has documented that unilateral headache, a headache that consistently shows up on one side only, particularly when it's new, persistent, and unrelated to any prior headache history, is a flag that warrants imaging. Not a panic, an imaging appointment. Here's when this type of headache tends to peak. Late afternoon and evening, after a full day of activity, when the cardiovascular system has been working for hours and fatigue begins to affect pressure regulation. And again, late at night, when everything is quiet and you're lying down and there's nothing to distract you from the pulse behind your left eye. If you have a headache right now that feels like what I just described, and it's been there for more than a few days, make a note, date it, describe exactly which side, exactly what kind of pressure. That record is going to matter when you sit across from your doctor. Sign 3. The vision that flickered. I want you to stop for a moment and think about whether this has happened to you. You're reading or driving or watching something, and for just a second, maybe 2 or 3 seconds, something in your vision goes strange. Not blurry exactly. More like a section of what you're seeing loses its sharpness, or briefly goes dark, or appears as if someone held a piece of frosted glass over part of your eye. Then it comes back, completely normal. And you blink a few times and think, that was weird. And then you move on. That event has a medical name, amaurosis fugax, or transient monocular vision loss. And it is one of the most specific, actionable warning signs that exists before a stroke. What's happening is that a tiny clot or piece of plaque, the same material that builds up inside arteries over years, breaks loose and temporarily blocks the ophthalmic artery, which supplies blood to the retina of one eye. The retina is essentially an extension of the brain. When its blood supply drops, even for seconds, vision drops with it. And then circulation restores, and you see normally again. I always explain it to patients like this. The eye is the one window into the brain you can see through. What happens to the eye's circulation is a preview of what's happening, or about to happen, in the brain's circulation. A study published in the Journal of Neurology found that patients who experienced transient vision loss in one eye had a significantly elevated risk of ischemic stroke within the following 90 days if they did not receive timely evaluation and treatment. 90 days. That's the window. This one is not something to monitor and wait on. If you've had an episode like this, even once, even if it resolved completely, that is a same-week conversation with your doctor, not a same-month conversation. This week. If you've been nodding along to this video and this section just describes something you experienced, I genuinely want you to type yes in the comments, because you may have just recognized something that nobody around you knows about yet, and acknowledging it is the first step. Sign 4. The words that got stuck. This next one is the one I wish more people asked me about. Not slurred speech. Not full aphasia where someone can't form sentences at all. I'm talking about something far subtler and far more common in the weeks before a stroke than most people realize. You're mid-sentence and you reach for a A perfectly ordinary word you've used 10,000 times, and it's simply not there. It comes a beat later, or you substitute something else without meaning to. Or you're telling a story and the thread slips for a moment, and when you pick it back up, the person across from you has a slightly puzzled look on their face. Or this. You're reading something and you realize you've read the same paragraph 3 times, and the words aren't assembling into meaning the way they should. What's happening is intermittent disruption to the language centers of the brain, primarily Broca's area and Wernicke's area in the left hemisphere, caused by transient ischemic episodes. Brief reductions in blood flow that don't cause lasting damage, but signal that the system is under strain. Think of it as a Wi-Fi signal that keeps dropping for 1 or 2 seconds at a time. You're still connected, but something is interrupting the signal. The American Stroke Association identifies recurring word-finding difficulties, especially when they're new, and especially when they're accompanied by any other sign on this list, as a cluster that demands clinical attention. People are often too embarrassed to mention this symptom. They attribute it to stress, poor sleep, brain fog, aging. And sometimes it is those things. But when it's new, when it's getting more frequent rather than less, when it happens during moments when you're not tired or overwhelmed, that's not a normal brain day. That's a signal. Think back to someone you love. Have you noticed them searching for words lately? Not in the way they always did, but differently? More often? More frustrated? Sometimes we notice it in others before we notice it in ourselves. Tag someone in this video who needs to watch it. You might be doing something important for them. Sign 5. The numbness that has no explanation. This is where it gets serious. And I say that not to alarm you, but to make sure you're still paying full attention. Numbness. Tingling. A sensation of pins and needles in one arm, one leg, one side of the face, that appears without a clear cause and disappears within minutes. Not the numbness from sitting with your legs crossed too long. Not the tingling from sleeping on your arm. Your body knows the difference. The numbness I'm describing arrives without pressure on the area. There's no positional explanation. You haven't been leaning on anything. You didn't fall asleep in a strange position. It just starts. And it's on one side. That detail, one side, is critical. The brain's sensory cortex maps the body in a very specific way. One hemisphere processes sensation from the opposite side of the body. When numbness is unilateral, affecting only the left arm and left leg, or only the right side of the face and right hand, that lateralization is the body telling you exactly which hemisphere is being affected. I always tell my residents, the brain leaves fingerprints. Unilateral sensory symptoms are one of the clearest fingerprints it leaves. According to data from the CDC, roughly 795,000 people in the United States have a stroke each year. Of those, a significant percentage experienced transient sensory symptoms, numbness or tingling on one side, in the days or weeks prior that went unreported. This symptom tends to be worst at night. You're lying still. There's no activity to override what your nervous system is registering. And in the quiet of the bedroom, with the house dark and your family asleep, you feel it. This strange, sourceless tingling running along one side of your body, and you don't know what to make of it. So you adjust your position, you wait for it to pass, and it does. And then it comes back the next night. That recurring pattern, the same side, the same time, the same absence of a positional cause, is not a sleep problem. It is a neurological pattern, and it deserves the attention that a neurological pattern deserves. Sign 6. The dizziness that arrived without invitation. Remember Gerald, the man I mentioned at the very start? The retired coach who said he felt off for weeks? This is the sign he almost missed, the one that would have changed everything. Not lightheadedness when you stand up too fast, not the spinning that comes with an ear infection. I'm talking about episodes of true vertigo, the room moving, the ground tilting, the feeling that you are in motion even when you are perfectly still, that come without warning and pass within seconds or minutes. Gerald told his wife it was his inner ear. She believed him. Because it made sense. Because that's what we reach for when the real explanation feels too large. Sudden episodic dizziness is one of the 5 symptoms that FAST, the stroke awareness acronym taught in emergency medicine, doesn't fully capture. The face drooping, the arm weakness, the speech difficulty. Those are late signs. The dizziness, the balance problems, the vision changes. Those are early signs. The ones that precede the event. What's happening with episodic vertigo in a pre-stroke context is disruption to the posterior circulation, the cerebrovascular system, which supplies the brainstem and cerebellum. The brainstem manages your most fundamental sensory processing, including the vestibular system that tells you where you are in space. When that blood supply falters, the world spins. Think of it like this. The vestibular system is a gyroscope inside your brain. A gyroscope needs continuous, stable power to maintain its reference point. Cut the power for 2 seconds and the gyroscope wobbles. Restore it and the gyroscope resets. But every wobble is a warning that the power source is unstable. Research published in the Annals of Neurology found that episodic vertigo, combined with any one of the other signs in this video, raises stroke risk dramatically compared to either symptom appearing alone. This combination is what clinicians call a cluster, and a cluster is never coincidence. If you've been experiencing dizzy spells that seem to have no clear cause, and you've been adjusting your daily life around them, sitting down more quickly, avoiding certain movements, staying close to walls, your body has already been accommodating something it shouldn't have to accommodate. Sign 7. The fatigue that sleep cannot touch. This last one is the most dangerous of all, not because it's the most dramatic, but because it's the most invisible. I have never seen this described accurately in a patient brochure. There is a specific kind of fatigue that can precede a stroke that is entirely unlike normal tiredness. It doesn't come from poor sleep, though your sleep may also be suffering. It doesn't resolve with rest, which is the detail that gives it away. You sleep 8 hours and wake up feeling like you didn't sleep at all. You sit down in the middle of the afternoon, not because you're bored, but because your body is demanding it. Tasks that require sustained mental effort feel heavier than they ever have. And the heaviness isn't in your mood. It's neurological. What's happening is this. When the brain's blood supply is inconsistent, when regions of the brain are experiencing repeated, brief reductions in oxygen, the brain is working harder than it should have to just to perform its ordinary functions. It's compensating. And compensation costs energy. The fatigue you feel is the cost of that compensation. Think of a laptop running on a battery that's slowly failing. The screen is still bright. The program's still open. But the machine is running hot. The fan is louder than it used to be, and the battery drains twice as fast. The computer is working, but it's working under strain. A landmark study in Stroke Journal found that neurological fatigue disproportionate to activity, particularly when combined with cognitive slowness, was significantly associated with subclinical cerebrovascular disease, meaning damage to brain vasculature that hasn't yet caused a full stroke, but is progressing. This is the symptom that people absorb into their identity. They stop saying, "I'm not myself lately," and start saying, "I'm just getting older." They adjust their expectations downward. They stop mentioning it to anyone because it sounds like a complaint rather than a symptom. Let that sit for a moment. Over 795,000 strokes a year in the United States alone. A third of them in people under 65. And of those, a substantial proportion reported to researchers afterward that they had experienced significant unexplained fatigue in the weeks prior. The weeks prior. Not the hours before. The weeks before. If you have been tired in a way that doesn't make sense, that doesn't match what you've been doing, that doesn't respond to sleep, that is quietly changing how much of your life you're engaging with, that is not a complaint. That is a clinical observation, and it deserves to be treated as one. What to do right now? I want to bring you back to something. Gerald is still alive. He recovered, significantly more than we initially expected. His wife was relentless in his rehabilitation, and he found, in his words, most of himself again. But the version of his life he had before that morning in the kitchen is a version he never got back completely. He didn't know what he didn't know. That's not a failure of character. It's a failure of information. So here's what I want you to do. Tonight. Not this month. Tonight. Write down which of these signs you recognized in yourself. Be honest. Write the date. Note which side of your body is involved if any sensation is one-sided. Note what time of day these episodes occur. That document, even if it's 3 sentences in your phone's notes, is the beginning of a conversation with a doctor that could change your outcome entirely. You don't need to catastrophize. You don't need to go to the emergency room tonight unless you are currently experiencing sudden severe symptoms. What you need to do is make the appointment this week and bring those notes. Tell your doctor you've been experiencing one or more of these symptoms: unsteadiness, one-sided headache, brief vision changes, word-finding difficulty, unexplained one-sided numbness, episodic dizziness, or unusual neurological fatigue, and that you'd like to discuss imaging. You are allowed to ask for that. You are allowed to advocate for that. If this video helped you see something in yourself that you've been quietly carrying, the fatigue, the balance, the words that keep slipping, share it with someone who needs to hear it. Not on my behalf, on Gerald's. On behalf of everyone who said, afterward, "I wish I'd known." You know now. Take care of yourself. And please, don't wait for the thing that makes you wish you hadn't.